Most of the clinicians, we are not aware about this problem. The problem is whenever the elderly patient, they will come to us, they will explain a specific disease scenario which we all have to understand. वो क्या बोलेंगे कि मैं मॉर्निंग वॉक कर रहा था बट अभी कुछ महीनों से मेरे को ऐसा फील हो रहा है मैं आई एम नॉट एबल टू मैच माई फ्रेंड्स इन द मॉर्निंग वॉक. These are the population where this is a major problem. Whenever we try to explain them कि आपको सर्जरी जरूरत है, they get panic. कि यार सर्जरी इस एज में 75 में 70s में कैसे मैं ऑपरेट कराऊंगा, इज इट सेफ? तो सन विल बी कॉलिंग फ्रॉम यूएस, नो नो पापा आर यू अ मैड, यू कैन नॉट गो फॉर सर्जरी इन दिस एज. बट उनको इतना पेन होता है कि दे ऑलवेज से कि आई वांट टू गेट ऑपरेट, आई वांट टू गेट रिड ऑफ दिस पेन, आई वांट टू लीव माय लाइफ, आई डोंट वांट टू. अगर जीना है तो अच्छे से जिए. जी. Okay, if you are above 80 years or above 70 years, elderly person and having a constant back pain, you are not being able to walk properly. With some walk, like 4 5 minutes, you get tingling, numbness of both limbs, weakness is there, and your life is being hampered. But still, age does not matter for enjoying your life. You need to be up and about, move mobile, and do things, a lot of things. So, if it is hindering your life, then there is this unilateral biportal spine surgery, which is the fourth generation recent advancement in spine surgery. So now what is the problem with this thing coming to the picture, and old disease people not living a good amount of life, not being able to reach their full potential. ये दोनों के बीच में spine endoscopic spine surgery is really doing a magical job. So, or even elderly people can get operated and without any screws. That is the main point. So, if we haven't put any screws into the back, the neural structures are freed properly with a good visualization and with a minimal scar, subcentimetric scar, then it's a wonderful magic that is happening here. So, if you have these sort of things, then it's unilateral biportal spine surgery. So I want to ask Dr. Atman, how is it possible that without any screws we can treat this sort of patients? So before that, we'll discuss this problem in detail, which is known as claudication. This is very common in elderly population. Now, this is a disease which normally didn't have been attended before. Most of the clinicians, we are not aware about this problem. The problem is whenever the elderly patient, they will come to us, they will explain a specific disease scenario which we all have to understand. वो क्या बोलेंगे कि मेरे को ना बैठने से सोने से कोई प्रॉब्लम नहीं है. फिर क्या, मैं पहले मॉर्निंग वॉक करता था. ये टिपिकल सिम्पटम होता है कि आजकल लोग फिटनेस के लिए बहुत ज़्यादा मॉर्निंग वॉक करते हैं. एल्डरली आल्सो ट्राइंग टू फिट. मॉर्निंग वॉक कर रहा था बट अभी कुछ महीनों से मेरे को ऐसा फील हो रहा है मैं आई एम नॉट एबल टू मैच माय फ्रेंड्स इन द मॉर्निंग वॉक्स. जो वॉक करते हैं दोस्त, 4 5 दोस्त, एल्डरली ऑल एल्डर सेम एज ग्रुप, वो वॉक करते हैं. कुछ लोग बोलते हैं कि नहीं, मैं तो उनके जैसा और चल नहीं पा रहा हूँ. नॉर्मली अपार्टमेंट्स में लोग रहते हैं तो मिलके मॉर्निंग वॉक करते हैं, या क्वार्टर्स में रहते हैं मॉर्निंग वॉक करते हैं. तो कुछ देर के बाद वन पर्सन विल से आई एम नॉट एबल टू वॉक और मैच यू फॉर द मॉर्निंग वॉक, आई हैव टू सिट. सो दिस इज द टिपिकल प्रॉब्लम वेयर दे इनिशियली अंडरस्टैंड द प्रॉब्लम. उसके बाद बोलेंगे मैं मार्केट जाता था मॉर्निंग में, शॉपिंग वॉपिंग करता था, कोई रिटायर्ड हो गया हूँ, कुछ काम नहीं है, बट मैं मार्केट थोड़ा जाता था या पोती को स्कूल छोड़ने जाता था. तो ऐसे कंडीशन में वो जाते थे और कुछ बोल रहा हूँ चल के नहीं जा पा रहा हूँ. भी मेरे को गाड़ी लेना पड़ता था, पड़ रहा है क्योंकि गाड़ी चलाता हूँ तो ठीक रहता हूँ, साइकिल या बाइक में जाता हूँ तो स्कूटी में जाता हूँ तो कोई प्रॉब्लम नहीं है. बट जब मैं चलने की कोशिश कर रहा हूँ, नहीं चल पा रहा हूँ. और दीज आर द पॉपुलेशन वेयर दिस इज अ मेजर प्रॉब्लम. एंड मोस्ट ऑफ अस, पहले क्या होता था इंडियन पॉपुलेशन में या साउथ ईस्ट एशिया के पॉपुलेशन में, लोग इतना लेंदियर सर्वाइव नहीं करते थे. बट आजकल बिकॉज ऑफ नो बेटर मॉडर्न मेडिसिन से वो देयर पीपल आर ऑन हेल्दियर डाइट, ऑल्सो फाइनेंशियल अपलिफ्टमेंट, उसके वजह से पीपल आर लिविंग हेल्दियर एंड लॉन्गर. तो जस्ट बिकॉज हेल्दियर एंड लॉन्गर लिव करें तो ये डीजेनरेटिव प्रोसेसेस वगैरह भी उनके पास आ जाता है. दे आर नॉट एबल टू, एंड द क्लॉडिकेशन इज अ डीजेनरेटिव डिजीज. तो naturally patient cannot stand for long, they cannot walk for long, and they want to enjoy life because they're stable, there's no disease, nothing, their fine aging is happening. तो नहीं चल पाता. तो जैसे कि हमारे पास पेशेंट्स आते हैं आजकल, किसी सपोज दी फादर इज कमिंग, ऑल फैमिली मेंबर्स आर लिविंग अब्रॉड. नो, कोई सन यूएस में रहते हैं,
daughter is in Australia and the parents are here. सो डिजीज में साथ आते हैं और दे कंसल्ट द डॉक्टर. वो कैनाल स्टेनोसिस होता है, कैनाल स्टेनोसिस का ट्रीटमेंट फिजियोथेरेपी या ऐसा कुछ में ट्रीट नहीं हो पाता है. तो डेफिनेटली अगर उनको वॉक करना है तो सर्जरी करना पड़ेगा. तो नेचुरली व्हेनेवर वी ट्राई टू एक्सप्लेन देम कि आपको सर्जरी जरूरत है, दे गेट पैनिक कि यार सर्जरी इस एज में 75 में 70s में कैसे मैं ऑपरेट कराऊंगा, इज इट सेफ? तो सन विल बी कॉलिंग फ्रॉम यूएस, नो नो पापा, आर यू अ मैड, you cannot go for surgery in this age. But उनको इतना पेन होता है कि they always say कि I want to get operated, I want to get rid of this pain, I want to live my life, I don't want to. अगर जीना है तो अच्छे से जिए.
जी.
So that is what they
Telco really, the walk would be like half an hour, 1 hour, but अब तो consider भी नहीं चाह यार,
they are psychological scenario. एक ही चीज बचा था कि वॉक करके थोड़ा सा अच्छा फील करें, वो भी चला गया. तो दैट इज व्हाट बिगर स्पाइन प्रॉब्लम. तो मोस्ट हम लोग स्लिप डिस्क करके बात करते हैं, ये बहुत बड़ा डिजीज प्रोसेस है.
एग्जैक्टली इसी पॉइंट पे थोड़ा आपको रोकता हूँ मैं यहाँ पे. अब ये सिनारियो जब है तो व्हाट वाज हैपनिंग इज, ये लोगों में फियर क्यों आया है स्पाइन सर्जरी के? क्योंकि पहले ओपन सर्जरी हुआ करती थी, इट वाज द लॉन्ग बिग इंसिजन्स, द मसल वुड स्प्रेड लाइक दैट एंड लॉट ऑफ ब्लड लॉस वाज गोइंग ऑन. एंड वी because we did a lot of bone work there, bone became unstable
Unstable,
we put the screws over there.
and that is very painful.
That is very
Because
painful.
screws are indicated where there is a fracture. That is a basic concept of screw or any fracture principle. If the bone is broken, you have to fix it, stabilize it. If this rod is broken, you have to stabilize it. But when there is no breakage, old age में क्या होता है ना, all the bones are joined together. Bones are very strong because for a healthier lifestyle, people used to take a lot of calcium and everything. And the bones are strong. And bones are strong, but because we are cutting a big incision and cutting all these bones again, then it leads to instability. That is why you put the screws. Again, second thing is, क्योंकि fear है elderly population में, इतना बड़ा incision, इतना blood loss, screws, definitely it is going to the psychological safety. क्यों देख के सर्जरी डर जाते हैं कि यार ये इतना बड़ा इंसिजन, इतना बड़ा बैक सर्जरी, हाउ कैन आई डू? आई एम 70 years old, I'm 75 years, I'm 80 years old. It's not possible to do it. So for them specifically, we have this biportal endoscopic surgery. Biportal is also known as the fourth generation endoscopic spine surgery. If you are not breaking, there is no reason to make it again. So with the biportal endoscopy, you can directly go there in the back and operate the area which is causing problem. Mostly in these cases, it is a ligament which is causing the problem. Ligament is the problem, means most of us, we don't understand ligament is a problem. But actually in elderly, the ligament is a problem. Once you remove the ligament, the patient feels very nice. And the incision is not even the size of your little finger.
Sub-centimeter.
Sub-centimeter incision. And if the whole surgery is done with plasma, there is no blood loss. So now if you give open surgery, there will be 1 liter blood loss and the physiology does not allow you to operate big surgeries. The patient may get destabilized and all. So we all have seen this in all their working current practice, but this is a new dimension for them. This is a game changer for them, where you operate the patient without any blood loss. You have a sub-centimetric, as you said, incision smaller than this, and the person works on this evening, on the next day. And the son, most of the time has happened like this. The people who are the relatives and the children who are living abroad, they will call no in the evening or the next day, "Mommy, how's your surgery and what you are doing?" So the mother will say, "I'm sipping coffee in my house, so I'm very happy." So hey, you have reached house. This is so surprising because this is like a minor. We cannot call it as a minor surgery, but it feels like a minor surgery because there is no big incision, no cut, no blood loss. So no muscle butchering. So that is how the surgery is so safety. So psychological safety, whenever we show them this, so we are going to have a laparoscopy on your back, like laparoscopy. You have to make two small ports and you operate. So they understand how the situation is, and definitely we don't need screws on the back. Screws are painful. If screws are needed only when there is fractures. So but there is no need of screws, even if the spine is bent, because we cannot change God's way of disease. We have to make their life comfortable, not the alignment which God has made. So with biportal, they can get the cure immediately and they can get back to their old lifestyle very soon. And this is very, very safe for the patient because no blood loss, very reduced chance of infection, saline median. So doctors can see, because of the lack of bleeding, when there is no blood, we can see the structures very well. And with the endoscopy, the scope goes in near to the nerve, rather than when you operate in open surgery or microscopic surgery, everything stays outside the body. But the endoscope goes inside the body, and it will give you a very magnified vision of the surgery, everything in a crystal clear area, so we can operate beautifully. And the surgery is also very fast, so within maybe around 20-25 minutes for per duration we take. And maybe around within, suppose the patient is having multi-level disease also, 2-3 levels will be done within 1 hour, within 30 minutes, within 40 minutes, so they can walk in the evening and go home on the next day. So that is the beauty of the surgery, where the open surgery patient stays in the hospital for 7 days, 10 days, putting screws. Next day back pain is severe because of the butchering of the muscles and all everything gone. So that is why we say this is spine endoscopic technique, which is known as biportal, is a game changer. It's a magic. And the same, it will, now the awareness is getting created, and same like cataract surgery, like joint replacement. No, now somebody is going for a cataract surgery, you understand, they don't even think, they don't even inform, okay, I'm going for a cataract surgery, because it has been accepted so well in the society. You go 20 years back, when mother was saying, you want to operate on my eye, I go blind. Now everybody is going for cataract surgery. Everybody wants to see. Yeah, now, yeah, no, if everybody wants to walk, then this is a solution for them. This is magical, really. And this is the experience of the patients.
Yeah, so if you are like 60 years and or above, and you still feel younger, or if you are 80 years and you look like a 60 years old person, and you have this sort of back pain, not being able to enjoy your life, not being able to walk, then it's really a magical thing. You should look into it and get a proper opinion from a spine endoscopic spine specialist.